U.S. Secretary of State Mike Pompeo said 2 weeks ago that India and the United States were working together to develop a vaccine against the coronavirus. However, the U.S. Secretary of State's statement did not come as a surprise to anyone. The two countries have jointly pursued an internationally recognized vaccine development program for more than 3 decades. In the past, both countries have been working to prevent dengue, intestinal diseases, influenza and TB, and a dengue vaccine trial is planned in the near future. India is one of the largest manufacturers of medicines and vaccines in the world. There are about a dozen large vaccine companies and several smaller companies that make food for diseases ranging from polio and pneumonia to measles and rubella. More than half a dozen Indian pharmaceutical companies are now developing vaccines against the coronavirus. One of them is the Serum Institute of India, which is the largest number of vaccine manufacturers in the world in terms of manufacturing and selling vaccine food. The pharmaceutical company has been producing 1.5 billion doses of the vaccine every year for almost 53 years. All of these foods are prepared primarily at 2 centers in the western Indian city of Pune. The company also has 2 small plants in the Netherlands and the Czech Republic, employing about 7,000 people. The company provides about 20 different vaccines in 165 countries. 80% of its vaccines are exported at an average price of 50 US cents per dose, which is considered the cheapest in the world. The company has now partnered with American biotech company Xnxx to develop a vaccine that offers direct mitigation. There are currently more than 80 vaccines being developed around the world to prevent coronavirus. The vaccine is made by reducing the potency of the virus that causes the disease or by eliminating its harmful agents, but the virus is kept alive. Because the power of the germs that spread the disease in the lab is reduced, it does not cause any disease, and even if it does, it is very light. We are planning to test this vaccine on animals, rats and monkeys, in April, and by September we will be able to start testing it on humans, Adar Poonawala, Chief Executive Officer of the Serum Institute of India, told me over the phone. Maybe. Single quote. Adar Poonawala's company is also a partner in the mass production of vaccines developed by Oxford University. The vaccine is supported by the British government. The basis of this vaccine will be the virus found in bin mans. Clinical trials on humans began in Oxford on Thursday, and if all goes well, scientists hope to have at least 1 million doses of the vaccine ready by September. Adrian Hill, a professor at the Jenner Institute in Oxford, told the BBC's James Gallagher, "Get out of the lockdown. This is where vaccine makers in India get the upper hand." The Serum Institute of India alone has the additional capacity to produce 400 to 500 million doses. "We have a lot of potential because we have invested in it," says Adar Poonawala. There are other companies as well. Hyderabad-based Bharat Biotech has announced a partnership with the University of Wisconsin-Madison and the American company Flugan to produce 300 million doses for global distribution. Zydius Cadillac is working on 2 vaccines, while Biological E, Indian Immunologicals and Mine Vaccines are developing 1 vaccine each. In addition, 4 to 5 domestically developed vaccines are still in the early stages. Soumya Swaminathan, chief scientist at the World Health Organization (WHO), said, "Maybe." The owners of these companies had the goal of running a successful business as well as doing good for the world, and this is a model in which both win. However, experts warn that people should be vaccinated in the market. Do not expect early availability. David Nibaro, a professor of global health at Imperial College London, says humans will have to live with the risk of coronavirus for the foreseeable future because there is no guarantee that anyone with successful vaccines will be ready. And Tim Lahae, a vaccine researcher at the University of Vermont Medical Center, warns that one of the main reasons people are worried about the coronavirus vaccine is that it can damage the immune system. Globally, more than 2.5 million people have already been infected with the COVID-19 infection, and more than 2.5 million of them have died. In such a case, developing a safe vaccine that needs to be developed on a large scale requires a period of time and is a difficult matter because before it is released, it has to be tested on all kinds of people with its chemical and biological properties.